Welcome to Pennsylvania in Focus. I'm Kristen Smith, Pennsylvania editor for the Center Square. Joining me today is the Center Square's Pennsylvania reporter, Anthony Hennon. This week, Anthony brought us the latest development in the state's EMS crisis. There's been a flurry of hearings over the last several weeks that we've covered, exploring all of the systemic failures within the system that has pushed it to the brink of collapse. And it seems like EMS officials are really growing tired of this entire process and very frustrated, so much so that they've had a lot of things to say about the state support over the years, and it was definitely less than positive. So, Anthony, can you tell us more?
Yeah, so usually with these hearings, a lot of it focuses on the financial side, on the staffing side. A lot of these departments or a lot of these ambulance services are either running at a loss where they can't get reimbursement to equal the cost of sending out an ambulance. Others, it's simply they are really hurting for funding. Fundraising cannot fill the gaps that they are experiencing, financial pressures from rising costs and such. This time around, though, it's a little different. This time, more of the focus was on, I guess you could say, the statewide organization here, where they talked about how a lot of these things, the Bureau of EMS that's housed within the Department of Health, regional EMS councils, the Pennsylvania Emergency Health Services Council, all these organizations are essentially working in silos, as Gary Waters, who's the executive director and EMS chief of the Altoona Mobile Emergency Department, said. So that's one half of the issue, is that there's not as much communication, there's not as much coordination for some of these issues. But another issue that Waters and some others flagged was essentially seeing the Bureau of EMS as being adversarial. Essentially, we've seen a lot more investigations of EMS services in the last couple of years from the Department of Health. So Heather Scherer, executive director of the Ambulance Association of Pennsylvania, pointed to investigations going up sometimes dramatically. In 2021, there were 69 investigations. Last year, there were 116. And then this year, there have been 45 so far. They summed it up as the Bureau has shifted its focus to compliance and discipline instead of improving a horribly fractured and weak system. So it seems like a lot of these EMS agencies are feeling more pressure put on them from the state government rather than getting any help or getting much helpful direction here. They're being sort of portrayed as the bad guys.
So what was the reaction from lawmakers upon hearing this? Did they offer any solutions?
Some of this was just a little bit of shock, I suppose you could say, where coming into the hearing, it was billed sort of as focusing on long-term sustainability, but then a lot of the discussion shifted to problems with how the State Bureau of EMS has been kind of treating some of these places. So, legislators acted sympathetically. They argued that, they would help correct the situation and work to be more collaborative rather than adversarial on the state level. But as far as, potential solutions proposed, there wasn't as much being thrown out there. But I think this is an issue that'll stick around. I think a lot of these problems have been exacerbated simply because you're seeing a much dramatic drop off in resources, either in terms of staffing for a lot of these local first responder outfits or simply resources, where you see more EMS services or more volunteer fire departments shuttering or consolidating. So I don't think there's a quick fix here, but I think this is something new that's on state legislators' radars.
Listeners can keep up with this story and more at thecentersquare.com. For Anthony Hennon, this is Kristen Smith. Please subscribe and thanks for listening.